Hello, everyone, and welcome to today's webinar. This is Mike Stoecklein. I'm with the Institute for Enterprise Excellence, and my co-presenter today is Mark Graban. Mark and I put together a presentation a couple months ago for a different program, and we thought that people from both the Healthcare Value Network as well as some of our other contacts might benefit from some of this information. So we put together this webinar for you today. Hopefully you'll find it to be of interest. The phones are muted, but if you have questions along the way, you can use the chat function to ask us any questions, and we'll certainly devote some time to that at the end of the session. So I'm going to turn it over to Mark, and he's going to get us into this important topic of Dr. Deming's lessons of the red bead factory.
Thanks, Mike, and thank you everyone for being here at the Society for Health Systems annual conference where we planned on presenting together. I actually facilitated the red bead experiment. I'm going to actually kind of walk through a quick summary of it for you for those of you who have never participated, and more importantly, Mike and I will both share some of the key lessons from this whole experience. So to start off, why are we here? Mike has more experience with Dr. Deming firsthand, starting off his different workshops with a key question, if you want to talk us through that, Mike.
Sure. Whenever Dr. Deming was presenting, whether it was his 4-day seminar or a conference, or it could even be a small group of people, he would often pause and ask, "Why are we here?" And he would wait for some responses. And then he had his own ideas, and then Mark's going to share those ideas. But he thought that this was an important way to begin the conversation.
To learn and have fun. Right, and I think these are two goals that can go hand in hand. We're going to try to live up to that today. Hopefully, Dr. Deming will look down on us and approve of our attempts to have fun, including some fun sunglasses on Dr. Deming. Sorry, Dr. Deming.
I think he would like that, especially for the month of July.
Well, I think some of the key management lessons and questions that a lot of us are facing in organizations as managers or executives, I think cross industries. It's not just healthcare, it's in other settings. Real high level question, how are we performing? And I think more importantly, are we getting better or are we getting worse? How do we know if we're getting better or if we're getting worse? I mean, these are really fundamental things to try to understand. If we're getting better, does that help reinforce? Hopefully we've been doing some things that lead us to get better. If we're getting worse, do we understand why? And as we'll talk about in the session here, let's make sure we're drawing the right conclusions from data or information that we're looking at. What action should we take based on what we're seeing in performance data, or as Mike is going to talk about later, just based on our understanding of variation within a system, even when we don't have numbers or metrics or KPI involved? What action should we take? Or maybe what action should we not take? The common expression of "don't just stand there, do something" is really kind of common expression. Dr. Deming would sometimes turn that upside down and say, well, sometimes don't just do something, stand there. That might have meant maybe the need to study the system, or to not overreact, or to not tamper, or to take actions that would actually cause more problems or increase more variation. Dr. Deming said management must understand the theory of variation. I mean, I think there's a lot of really practical matters here. If you don't understand variation and how it comes from the system itself, you can only react to every figure. And I think this is where, in the context of daily lean management, we're looking at daily charts, and there's going to be ups, there's going to be downs. How do we react accordingly? How do we view that variation in our system appropriately in a way that's helpful? Dr. Deming said, if we're always reacting to every figure, every up and down, better, worse, the result is that you often overcompensate when it would have been better to just leave things alone. So we're going to be talking today about the red bead experiment. Mike, maybe if you want to talk a little bit about the funnel experiment and some of these lessons, the basic lesson around over adjusting or tampering a system.
Sure. Perhaps when we get into some of these notions of tampering, we can build on what Dr. Deming talked about with the red bead. And he had that other demonstration where he had a kitchen funnel and would demonstrate different ways that the efforts to make things better actually made matters worse. So I'd be happy to get into that when we get to that point.
Yeah, and there's an online funnel simulator that puts those lessons into really, I think, helpful contact. I'm going to share that in the chat window for those who want to learn more about the funnel experiment and the lessons there. But the red bead experiment, I think, helps bring a lot of these lessons to life in a way that helps build intuition and understanding about variation and managing systems and managing people. The game, the red bead experiment or the red bead game is very closely associated with Dr. Deming. I was a little surprised to learn a couple years ago that it was actually not created by Dr. Deming, if that matters, and maybe it doesn't matter, but it was created by Bill Bowler, who worked at Hewlett-Packard. He created that as a gift for Dr. Deming, and Deming used what you could call the red bead experiment or the red bead game in his seminars for the last 11 years of his life or so. And Mike, you got to observe some of these directly, right?
Yeah, it's interesting. Deming would use this on day one of the 4-day seminar, and he would draw back to it on the next 3 days, and it was a very emotional experience for people. I think we'll be talking about that. I think one of the reasons why he really liked it was there were so many lessons he could draw upon showing how the prevailing style of management, without knowing how to understand variation, could do a lot of damage, and a lot of the damage was psychologically. And he talked a lot about how this experience affected people, and they thought about it deeply those 4 days and then on the rest of their lives.
Yeah. So in the simulation, in the exercise, you've got a bucket container full of beads that contains mostly white beads and 20% red beads. There's a paddle, as you see pictured here in the video of Dr. Deming facilitating this. You bring up, when you run this, you bring up 6 volunteers, or you pick people as willing workers, was the term Dr. Deming used. Willing workers, you put them into a system where it's their job to dip the paddle into the beads, kind of agitate the paddle, pick it up and tip it so that the paddle, the beads slide off, and you're left with 50 beads in the paddle, some of which are white, some of which are red. And so, you train people, you tell them about, you can lecture them about the importance of quality, you can throw around whatever sort of slogans or expressions you might want to throw around about it being a pay-for-performance environment, quality being the most important thing. But you're throwing people into a system. The system is what it is, regardless really of the individual involved. So each of the 6 participants dips the paddle in, and here's some data from a time last year in San Antonio when I ran the exercise. We had 6 participants. You can see Jason, 11 red beads or 11 defects. Daniel with 12. We got down, Dina drew 13. Robert drew 8. Now, I think everyone playing the game realizes that the number of red beads, it's due to chance. It's due to common cause variation in the system, unless people try to cheat and pick the beads, and you don't allow them to do that. But you can see the variation in the results, and you can have some fun with this, and you can sort of maybe chastise Dina and kind of give her a hard time about creating the most defects. You could point to her and Jonathan and Daniel as being below average workers with below average results. You can pat Robert on the back because, look, Robert proved it was possible to only have 8 red beads. You can give Robert, in this case, a certificate, make him the willing worker of the day, give him a pat on the back, way to go. Kind of tell everyone else, you should watch Robert, watch how he does his work. And Mike said, with the emotion, people start getting a little bit upset at being called below average. People really get sucked into the experiment, even though they realize it's just an exercise and there's a lot of chance involved. But from this first round, and you see the results, I guess one of the lessons is that every system has variation. There's some amount of normal or common cause variation, as we see in these first results. I think one of the other key lessons is that standardized work alone doesn't necessarily ensure quality. When I run the exercise, I do a job breakdown sheet, or you call it a job guidance sheet, basically using training within industry training methods to train people, tell them we've got all the steps in the process, we have the key points, the reasons why. Like, we're trying to do maybe our best job of training, but yet there's still variation in the system. And I think that's an important lesson there. There's other things we would have to do to improve this system, to improve performance, to reduce variation. So one of the things we generally do after the first round is to set a goal or a target. So I usually put up a slide or a sign that says the goal is 3, and without putting up a lesson that says goals alone don't work. If we set a target or a goal that's not achievable based on the current system, that gets people really frustrated. That gets people demoralized. If we kind of threaten that the customer is going to take the business away from us if we keep producing red beads, there's too many red beads. People really do sort of take this to heart when they go to dip the paddle again. So you might kind of threaten punishment or kind of set a target. You can also, within the exercise, try to create an incentive or a bonus. And you can say, well, okay, well, to show that this is a performance-based culture, for anyone who can draw 3 red beads or fewer, I'll give you a $20 bonus. You kind of wave a $20 bill. I've never had to give away the $20 because 3 is a goal that's very unlikely to be achieved by the system. So I think when we think to the workplace, goals and targets that we set, it's one thing to talk about customer needs and customer requirements. You might talk about the need to do 60-minute door-to-balloon time in a hospital. If the current average is 120 minutes, just reminding people of the goal and offering an incentive could demoralize people. It could make people distort the system or fudge the numbers in some way. So we need to focus more on improving the system, not just using the carrot or the stick. So in round 2 of the exercise, you can see these results. The overall performance of the group was slightly better, but I think it's interesting to look and say, okay, well, Jason is now our poor performer. We can chastise him. Dina, we can see her performance improved from 13 reads to 8. Now, as management, we might pat ourselves on the back and say, well, we gave Dana that wake-up call. We've given her a motivational speech. We told her she needs to do better, and sure enough, look, she improved. Whereas Robert, who we had given the Employee of the Month award to, well, clearly he slacked off. Clearly he got kind of a big head, and unfortunately, you probably recognize this as just being fluctuation. They regressed to the mean. But if you don't understand that, if we don't understand variation, management might draw some inappropriate conclusions and say, well, when I pat people on the back, they slack off, so I'm going to stop giving rewards. And when I chew people out, they get better. And that might be the wrong conclusion to draw.
Yeah, so Mark, it's interesting that Dr. Deming would, at the end of the day, say, well, told up the figures, and then he would come back and say, okay, management wants to do this, or management wants to do that. So he was a foreman, but he would have this management that was you'd never heard from or saw, but he would talk about what they wanted to do. And you're absolutely right. He would make these comments out loud about, well, it must be because of good management that we went from 64 to 62. So clearly we're on the right track. And he was articulating a lot what's going on in the minds of people with the prevailing style of management. And he called it the mythology of management, how we think because of things that we do, it has a cause and effect on what we see. And so he would verbalize these things out loud, and of course the crowd would then understand Maybe that's me that's making those conclusions. Maybe that's me that's the foreman, or me that's management that's directing this charade.
Yeah. And there's a lot of lessons. I mean, if you read Peter Senge and systems thinking, and you kind of come to understand, or system dynamics, it's really hard for people to draw correct cause and effect relationships, especially when there's time delays in between cause and effect, and we make all sorts of specious conclusions about, I did something, the results change, therefore the results change because I did something, and that might not always be correct. So we had the first two rounds. We can remind people about the need to produce quality and do a better job, and in the exercise, one version of the exercise has you throughout this program. It's got an acronym, it's the STAR program. And you can sort of condescendingly tell people that, to ensure quality, you need to stop and think about what you're doing, as if lack of thinking was the problem before, and then act, and then review what you did. I mean, this is a real program from a real organization. You can step back and say, well, what good does something like that do if we're not changing the system in some meaningful way? We often use different posters and slogans. One of the lessons from Dr. Deming is that slogans and posters don't work and can be demoralizing. This one here, this poster, that I think sort of looks like Joseph Stalin. Like, this is not meant to be funny or ironic. Like, this is actually like a real poster that a company sold because they thought people would buy it because this would somehow improve the workplace environment. This poster is more along the lines of the beatings will continue until quality improves. But in the other round, we decided, so to go to the fourth round, we look and see, well, we did the third round, and then see the results. And we might add up the performance of everybody across those three rounds. So we now can see the total number of red beads was 65. Is that because of management? Back to Mike's point, is that because of management? Robert had 7, Jonathan had 18. So we might say, look, this is a pay-for-performance environment. We have no choice, we might say, but to fire the bottom 3 performers. We're going to fire the below average performers. So we choose Jason and Daniel and Jonathan, and somehow assume that if we have Jorge and Dina and Robert do twice as much work, that performance would improve. So there's, I think, all sorts of lessons here about randomness and variation. It seemed like bad luck that Jonathan and Jason especially were deemed to be poor workers, and they get punished and they get fired, and we could replace them with 3 other people. And I think in a system like this, it's clear to see 3 other people would probably get the same results. I think the more challenging question is thinking about our workplaces and what happens when we fire people who are deemed poor performers, people who have made mistakes. Are we going to just get the same results by bringing in new people into the same system?
And one of the things that Deming would bring out at this time, he would say, what a great contribution for management this is, a brilliant idea, keep the factory open with the best workers from the past. And he pointed out that it was random, and some companies actually use a process called ranking and yanking. It was popular, still is popular with a lot of companies, thinking that if you could just find the best people and keep the company open with the best people, you'll get the better results. And he would go on and on about this and pointing out the fallacy of trying to identify the top 10%. And as he pointed out, there was no top 10%. And again, that was another deep lesson about how broadly this idea affects people, and how important it is we have to understand it.
Yeah, and you think about the lessons of, it's the old the story of Lake Wobegon, where what did they say? Where all the children are above average, or something like that.
Correct.
I mean, in an organization, some people are going to have below average performance if that's really somehow being measured on an individual level. If you looked at the infection rates for different surgeons. Some are going to have above average infection rates, and some are going to have below average infection rates within the boundaries of that system that we're working in. Now, I mean, it's of course possible for every surgeon in one hospital to have infection rates that are better than the national average, but you know, we have to be careful about not drawing the wrong conclusions. So Dr. Deming, in his recap, he would read a letter that somebody wrote talking about the emotions and how it felt to be in this exercise, to be treated unfairly as a result of the randomness and the common cause variation. You can see that. Go to the Deming Institute blog. You can see some video of Dr. Deming on YouTube. But there's a related point from that from Lloyd Dobbins, who was an NBC news reporter who worked with Dr. Deming and others to create a documentary and training videos about quality in Dr. Deming. Dobbins said, summarizes Dr. Deming's view, workers will try to do a good job even when they know they cannot. Doing your best doesn't matter unless you know what to do, why you are doing it, and how to do it. And I think, to me, this is reminiscent of what I see with the best lean organizations out there that are trying to create a lean culture with a lean management system. A lot of Toyota's approach, of course, was influenced heavily by Dr. Deming. I think we need to step back and think about what happens when we have good people working in a bad system, and are we responding fairly? So I think one of the other key lessons here is that firing the below average workers doesn't necessarily work. So when we look at the results from the round after I'd fired half the workers, we can see 2 rounds by each employee, by each willing worker. Now here's one of those conclusions Mike kind of warned us about. The total number of red beads fell to 57. And a manager, again, might say, well, good, performance improved because we fired 3 of our people. Now what's pretty clear to everyone watching the red bead experiment is that that's not really true. But I think it challenges to think about times in the real world, in the real workplace, where people have drawn those same inaccurate conclusions. That this is all, again, just randomness and noise in the data, in the performance of the system.
There's some other things Dr. Deming would do. He would declare one of the days to be Zero Defects Day and how that was going to solve the problem. And one of the things people misunderstand is Dr. Deming was not against trying to get to near zero, but just declaring it to be Zero Defects Day, or that we will hereafter have 0 defects, is not the same as trying to seek perfection over time.
Yeah, I mean, he was opposed to slogans. I don't think he would have been opposed to error proofing or other methods that we use to more practically get to 0 defects. So what happens, if we take the data from the results of the exercise, for one, we see a table of numbers, and we can see some of the numbers are bigger than other numbers, but it's really hard to see trends and to draw conclusions when we just see lots of numbers. This is where I think sometimes things that we've created what I see people doing in lean daily management, they'll have tons of numbers up on a board, and they'll say, well, look, here's our dashboard. And I think, well, wait a minute, look at the dashboard on your car. It is not a dense table full of numbers. It's a couple of key driving indicators, if you will. And we want to make sure that we can visualize data and trends. And so an SPC chart, a control chart, is a very effective way of helping us do that, of seeing the difference between what's probably common cause variation versus a special cause event. So when we take all of those data points, the number of red beads, and we draw them out, we chart them out, we'd see the average was roughly 10 red beads. Again, 20% of them were red. We would expect 10 out of 50 beads on average to be red. But now when we chart it, we see the variation. Sometimes people are going to draw 12 red beads. Sometimes they're going to draw 8. One time they drew 18. we take this and calculate upper and lower control limits, which are the red lines. And what the chart tells us is that this appears to be what you would call a stable and statistically in control system. That it's pretty much random, that we could get any result between 3 and 18, which there's a reason why we set that goal and offer that $20 reward at the number 3, because it's very unlikely within that stable system for anyone to actually hit that performance level. So there's lots of resources you can find. Don Wheeler's book, Understanding Variation, I'm going to mention again later, is a great way of learning how to apply control charts to management data, to performance data, to make sure we're not overreacting to every up and down in the data.
And Mark, you bring up an interesting point that Deming would make too. He would ask people, so here's the number of red beads and here's the number of white beads. What's it going to perform at? And people would say, well, it's going to be 10. He'd say, well, then you would be wrong. And the point is he actually had 4 sets of paddles and beads that he used over the years. And each one of those together formed a different average over time. And the point he was trying to make is even though your percentage in the lot, in the supply might be 10%, you don't know until you watch your system perform as to what it is going to perform at. So he was trying to make a point about you have to let the process perform and you cannot prejudge what it should be. You have to have it tell you what it will perform at.
Yes, and you do that by observing the system and we might have a hypothesis that you would have 10 red beads, but then you need to observe and measure and adjust. Dr. Deming said a number of things, I think other lessons that are illustrated here. The worker is not the problem, the system is the problem. If you want to improve performance, you must work on the system. And in the red bead experiment, we're really not doing anything to improve that system, which again leads to some of the frustration and emotion that people feel. Management should be working with the supplier to reduce the number of red beads, reduce lot by lot variation. That's how to get better numbers. So I think one example of a systemic improvement that could be made in the red bead experiment would be to look at other suppliers. Why are we getting such a mix of red and white beads? It could be that we chose the cheapest vendor, and Dr. Deming would have warned us against choosing suppliers based on price alone. So one way of improving the system might be picking a slightly more expensive supplier that delivers better quality. Might be one way of reducing the total cost of performance. And Dr. Deming, he kind of zeroed in on numbers in the 90-something% range. 94% of the problems in business are systems driven and only 6% are people driven. I think it's important. He doesn't say 100% of problems are due to the system. If you look at just culture, I think the just culture approach of trying to figure out when is something a systemic problem versus being an individual driven problem, I think lines up well with the Deming philosophy. And I think this flips on its head. I think more often than not, people jump to the assumption that it's a person problem unless proven otherwise. And I think the guidance here would be to assume, if anything, first that it's a system problem unless you've proven that somebody was really had some ill will, it was intentionally doing something bad. And that's really rare in the workplace. So when we do the simulation and the discussion, we ask a question and we would invite you to use the chat box, thinking about our workplace. What are red beads in our workplaces? I would propose, I mentioned earlier, infection rates in a unit, infections post-op could be red beads. If we have a very consistent, stable system, some people are going to have better performance than others, and that performance may shift and change over time. So we'll see if anyone else wants to type in maybe examples of what might be red beads. Mike, do you have any examples from the workplace?
Well, you think about the things such as on-time performance, how long it takes for people to flow through, say, a department in the emergency department, how long it takes people to do different tasks. Often we think about things that we can measure, and we declare certain things that are beyond a certain amount to be a defect or a red bead, and then how we react to that, again, pointing blame on the individual and not thinking about what are the systemic causes that could be influencing that. And so we see it in both the clinical setting and the non-clinical setting, you know, defects on bills, defects in different parts of the organization, and how we treat individuals, whether they were trying their best or whatever, has ramifications that we don't often see and think immediately.
Yeah, and I think it's tough for people sometimes to accept that the performance, the number, the defects, the metric is not completely due to our own best efforts and ability and skill, that there's common cause variation, that there is some sense of randomness. I think people don't want to accept that, even though I think it's sort of a law of nature that variation exists. And we need to better understand it. We're not making excuses for poor performance. I think we're trying to manage the system more effectively in a way that's more likely to actually improve performance. So we don't have any submissions of possible red bead ideas, but go ahead and feel free if something jumps to mind to type that in there. There's an online simulator that was part of an article, a really interesting study by the BBC. So not a medical journal, but a news source. So I put that link into the chat window. You can see the headline here. It's a little sensational. Can chance make you a killer? And they're talking about healthcare errors or harm or death as being a red bead. That we have different people performing in the same system may get different results. So in this simulation, and again, it's a simulator, so we're making certain assumptions. But it says, at least in this calculator, and go play with it online, every patient in every hospital has exactly the same chance of dying, and every surgeon is equally good. Not realistic, but we're purposely eliminating causes of variation here. This is to show what chance alone can do, even when the odds are the same all around. Oh, we did have a couple people, they said possible red beads might be patient falls, not giving medications on time, incomplete charts and documentation. Yeah, I think those are good examples of problems that could be very systemic. Some units are going to have more falls than others, even if they're all doing things exactly the same way. So if we look at the simulation, what they're doing is, just to run through it real quickly. Slide is not advancing. Here we go. You have 100 hospitals, each performing 100 operations. The probability, and you can adjust this, the probability that a patient dies is set at 5%. The government, though, says, and this sounds reasonable, if you have death rates that are 60% worse than the norm, that's unacceptable. So they might be threatening to punish hospitals that have a rate that's 60% worse than average. And that 60% number, maybe it just sounds good. Maybe it's completely arbitrary without understanding the role of variation in a system. So by those numbers, any hospital that has 8 deaths or more would be in trouble, would be deemed unacceptable, because the expected average would be 5 deaths. And then when you look at the simulation, there's a box corresponding to your hospital. So when you run the simulation, 100 hospitals, maybe not surprisingly, you end up with a normal distribution. And our hospital just happened to be smack in the middle with 5 deaths. Some hospitals had 0, and some had as many as 11 deaths. So the government, by its standard, would say we have 17 unacceptable hospitals. And again, this is a combination of just complete chance and an arbitrary cutoff that said, well, 8 deaths or more would be deemed unacceptable. When you run this simulation again, now our hospital, you see with the box, only had 1 death, and this time we had 15 unacceptable hospitals. We run the simulation a third round. Well, now our hospital had 8 deaths, and we're one of the unacceptable hospitals. I think when you run the simulation, it just kind of goes to show that we might be unfairly labeling individuals or hospitals as being bad performers when the results are just a matter of noise. I'd be curious to look at patient safety data. Do some hospitals swing in their performance wildly, or are the top performers always top performers? That might be an indication that it's not purely random. But this simulation, I think, is really interesting, and it shows the effect of a perfectly random system and the faulty conclusions that might be drawn. Mike, what are some of your reactions to this?
Well, I can imagine Dr. Deming reacting to this, and I think he would like this simulation. My hunch is he would make comments about this shows you what's wrong with the performance evaluation system, and he would also show the adverse effect of grading in schools and how the results of tests and grades are subject to random variation, and again, how careful we have to be with making conclusions about what things such as tests or performance evaluation show, and again, the effect on the individual.
Mm-hmm. And I think back to just a real quick story. I used to work in a large consulting group, and I always thought there was some element of randomness to how successful a consultant's project would be, because it was based on a number of factors outside of the consultant's control, and most projects were successful. But I always wondered, like, if somebody on their first project had the bad luck of the draw, if you will, and had low results, were they kind of forever labeled a poor performer, as opposed to somebody who maybe through that same element of chance had a successful first project? Some of that might not be fair, and it might lead to the wrong management conclusions in managing consultants over time. So Deming would say, I won't read the whole thing, one of his 14 points says basically, eliminate slogans and exhortations and targets. We see that in the exercise. These exhortations can create adversarial relationships. And I've seen this a lot in healthcare, where individuals feel like they're being called bad employees because of the bad performance, when they're trying their hardest and some of these problems are out of their control. It causes ill will, mistrust between employees and management. It was the same dynamic I saw back at General Motors 20 years ago, and it's sadly a similar dynamic that we see in some hospitals today. It gets in the way of people being able to work together and actually improve the system.
And if you want to create silos, all you have to do is create one of those spreadsheets, color some people yellow, some people green, some people red. And the silos are going to form because people are going to compete. They're not going to cooperate.
Yeah. So I'll share a couple examples from hospital real quick. This is real data. And someone had presented and they showed, okay, here's our ED arrival to admission times. And the description was, well, we have disappointing results because the results were worse than the CMS median, and they were far worse than the CMS top decile. Just telling people that this is disappointing maybe makes them feel bad, but it doesn't help people understand the system and improve the system. We want to be careful about not asking, what went wrong on a particular day. We need to look and see why, if we do an SPC chart, the average is worse than maybe our goal. We need to be asking, how can we improve the system, not what went wrong on a given day, other than this day, which appears to be a statistically out of control data point. We would want to understand, or this month, what was wrong, what was different that month, because this data point's the only one out of the whole group that's probably not due to common cause or noise. So instead of asking, why was performance disappointing yesterday, or why were we worse than our goal yesterday, we want to ask more common cause questions and not go looking for a special cause explanation to common cause variation. Those lessons, again, are very clear in Don Wheeler's book, Understanding Variation, which I need to click more, sorry. Just going to jump through this. Sorry. user error. Before we talk about Wheeler, he would also teach us that we need to be careful in making sure when there is a special cause that we react to it. Was it a bad outlier where we need to understand the system and prevent reoccurrence, or was it a good outlier where we need to understand if there was a change that we need to make permanent? Because there's two types of mistakes. We can react to an outcome as if it came from special cause when it was really common cause, or vice versa. And again, that book, Understanding Variation, is a good way of understanding these lessons and a number of lessons such as the power of charting data instead of just having tables of numbers. Wheeler also does a good job of pointing out the problems that come with these red-green categories like Mike had mentioned. So last example before I'll hand it over to Mike. Here's a real example, and this is from a hospital that's practicing daily lean management. I think it's good that they're charting data. The team is doing it. They're doing it daily. They're doing it by hand. The concern I have is with the red and green zones, that the goal or the red-green zone might be really arbitrary. And you can see there's smiley faces when performance was good, and in the green zone, I guess the equivalent, there's frowny faces or blame or making people feel bad when we're in the red zone. So if we take that data and draw a statistical control chart, we see it appears to be pretty much a stable system. And on average, that system is not meeting what we've deemed to be our performance goal. So I would say instead of all these different little smiley faces, there's an overall collective frowny face. And that drives us to ask, what can we do to improve the performance of the system, not just celebrate the occasional good day that appears to happen randomly. It's the same system these different days. Here's a similar chart where we see the control chart, we see the red and the green, and there's fluctuation. And people have written on the chart, I think they're trying to explain a special cause that might not be there. And the thing that was funny to me about this chart, I asked, well, why does this one have yellow? And the person, they kind of whispered, and they're like, oh, we're not supposed to have yellow. I said, well, why do you have yellow? I said, well, people were getting really demoralized that they were always in the red. So I'm like, I don't think adding the yellow zone or shifting where the green zone is, like that's not what makes people feel good. Actually improving performance, I think, is what makes people feel good, and that's what's better, I think, arguably, for the customer and for the people that we're trying to serve. So here, that's my quick cautionary tale about the red, yellow, green, and that maybe not being the best way to view the system, to manage the system. Mike, I'm trying to hand over control to you.
I just took it, so thanks, Mark. I appreciate that.
Okay. Thank you.
This slide shows something from the 1993 book Dr. Deming wrote, The New Economics, and it kind of summarizes what happens when we don't really understand the difference between the random variation and special cause variation. So Deming talked about, in his experience, 94% of the time the problem is something that management can handle, and 6% of the time it's something that's different. And we'll round the numbers off to 90% and say the world gives us roughly 90% random variation. And again, every system is different, so we're just making a point here. And that leaves us with 10% that could be due to the special cause variation. Now, our choices for action are shown on the rows here, on this column on the left. And under the prevailing style of management, a lot of times we are reacting to those individual points, individual behaviors, not just data, but situations. And so a lot of the time, and I've asked people how often you think that is, and they said, well, it's a good amount of time. I said, let's use 90% as the example, and then that leaves 10% to step back and study the system and look at the system. And if you do the math, you understand that here's the problem with tampering, that just by our own best efforts, we're making matters worse when we react to situations. Roughly 18% of the time, we're actually making the right choice. And then another problem is when you change the whole system based upon a one-time occurrence or a special cause variation. And Deming was talking about, or Mark earlier was talking about the lessons of the funnel. And that quadrant up here, this 81%, is another chapter in New Economics, and it's also talked about in Out of the Crisis, where Deming was pointing out there's different ways that you can tamper, and he would use the funnel as a demonstration, and he called them the rules of the funnel. And they are reactions such as reacting to rumors, overcompensating for bets, and a lot of those were things that you can quantify, but as we're going to be talking about, they're also reacting to behaviors. So Ed Baker, who worked at Ford and worked closely with Dr. Deming, made this contribution that I think is really important, because many people were trying to apply these concepts using data from what he called the factory floor, which is important, and not to say that it's not important, whether it's the factory floor or the hospital unit or whatever, when you have data, trying to understand what it's telling you. But he pointed out that it's really only 3% of where it could be applied. Where it needs to be applied is understanding variation as it relates to the overall business strategy or company-wide systems. And many times, again, those are going to be situations where you're not reacting to figures, but you're reacting to situations, behaviors, and you're using the principle of variation to apply this. And so, again, I want to reiterate that the most important application of this is not when you have figures, but it's when you're reacting to people and in the management of people. I made one reference to that earlier, which is in grading and how you respond to grades. Here's some other examples to think about. Hero Hackerboard, who also worked closely with Dr. Deming, put it this way, and I really like this explanation. He said, imagine three worlds, and world number one is you have a system and the individuals within the system, and all of the results, all of the performance comes from that system, and there's nothing that's due to the individual, absolutely nothing. And this is a good example of the red bead demonstration. It was controlled by Dr. Deming, it was controlled by the foreman, and he was going to either allow things to happen or not allow things to happen. But it's not a situation of the real world. One other way to look at the world, at the relationship between the system and the individual, is see them as separate. And this is often the way I think many times we do react to situations where we see something happen and we want to attribute it to the individual, either the individual person, the individual department, the individual hospital. Mark was referring to the simulation data by looking at the hospital-wide data. And in actuality, as Hero points out, the situation we're dealing with is probably really related to world number three, where there's some interaction between the individual and the system. And there's a variety of systems that we're responding to. And sometimes that system interaction is huge and sometimes it's small. But it's always there, and we have to understand it. And I want to go back to that equation that shows you have this is an equation Dr. Deming used to explain. You have the x, which is due to the individual, and then x plus y, x times y is due to the individual system interaction. And he said, Johnny in the 6th grade knows that you can't solve that equation because you have two unknown variables. So only a person who could solve an equation with two unknown variables can, with any confidence, claim that the variation came from the individual. So here's another point, and I guess one of the final points of our presentation is it's important to know how to react when you have figures, but you also have to understand that as much as you can learn about this, it's going to help you to react when you don't have figures, and thinking in terms specifically of behaviors you see with people. So Deming in 1993 wrote his book, The New Economics, and he pointed out that there's 4 bodies of knowledge that help explain the 14 principles that he talked about. We've been talking about an understanding of variation. He also talked about appreciation for a system and psychology, and we've been talking about all 3 of those in this presentation. The 4th part, yes, we've been talking about that too, how we build knowledge and how we make ideas, how we come up with ideas, how we reinforce those ideas. And so that's the full picture of, and it's the interaction of these bodies of knowledge that Dr. Deming was talking about. When we see that the systems do drive behaviors, then we would understand that this philosophy, this principle plays out when we don't have figures to look at. Here's a simple example of a system, the transportation system. Most people that drove today drove, if you're in this country, you drove on the right side of the road. When you came to a red stoplight, you behaved in a certain way. If you came to a roundabout, you behaved in a certain way. And all of those parts are part of a system that allows, the aim of the system is to get people and goods safely from point A to point B. So if you see someone driving and you wonder, why are they driving that way? Well, it could be due to rules. They either understand them or they don't. How they were educated. It could be due to weather conditions that are causing a behavior to take place. Training, which is different than education. Training is for a skill. It could be the light and the lighting conditions. It could be the roads or the road conditions that are part of the system. Whether law enforcement is present or absent can influence behavior. Anybody that slowed down when they saw a car, a police car, would know that to be true. The behavior of other drivers are a part of the system. If you have a backseat driver, that can be a part of the system. That can influence behavior. You throw a cell phone into the mix or into the system, and that too will influence behavior. So these are all the things to think about when you're starting to understand. And what I've seen, is it due to the individual or is it due to the system? So here's a few other examples. We have a person here who's taking vital signs from a patient, and that's going to produce some sort of results that then someone's going to make some conclusions about the vitals of that patient, whether it's their pulse, their blood pressure, their respiration. And that result comes not just from that individual that's doing it, but the system that trained them, the system that gives them feedback, and all of the parts of the system. And so you can't always ascribe those results directly to the individual. You have to think about the system. Same thing here with administering medications. There's a person getting medications. It has to do with the distractions. It has to do with the ability to read the instructions. It has to do with drug interactions, a lot of different system forces that are at play. Here's a non-healthcare example. You see some people here getting some financial advice from someone. Now, let's say this person is saying, I think you need to buy this annuity here. Well, that may be the right thing to do. It may be the wrong thing to do. That person's that's giving the advice is influenced by the system. They may be getting a bonus for selling so many annuities, or getting some sort of an incentive for doing certain things. And then finally, here's an example. We talked earlier about school and grades, and here's a kid that is bored and has fallen asleep in class. Well, is that due to the individual? Should we give that person some drugs because they've got some sort of disorder? Or is it a problem with the system? Is it something that the systemic forces are causing? Maybe it's not so much that one child that's laying his head down is attention deficit. It could be that the others have become boredom tolerant, and that there's something that's wrong with the system or the way that child best learns. So you have to ask these questions: is it the individual or the system? Now, by happen chance, we have another webinar that's occurring tomorrow, and I'll send everyone that attended today's webinar a link to this. It's a related topic. It has to do with performance evaluation. Our title is Performance Evaluation. How is this still a thing? And we just learned of some recent research that's been published from the Wharton School of Business, and it's an interesting body of knowledge that adds to this question about what sort of things are we attributing to individuals related to performance evaluation, and what is the performance evaluation actually doing? Is it possible to evaluate the performance of individuals? And there's some interesting summary comments made here from the researchers about how they studied this, and they found that you would think that a performance evaluation system could predict that a good performer is going to be good and a bad performer is going to be bad into the future. And that high reliability was there. It would be close to 100%. When they asked people in human resources, how reliable do you think your performance evaluation system is, they gave numbers up around 80%. In actuality, when they studied the data, they saw it was much closer to zero. Their data showed that it was about 27%. So performance evaluation is one of those examples where when we don't understand variation and the limits of variation, we're likely to make matters worse. And it's one of those situations that we have to understand the effect on individuals, similar to the effect of individuals with the red bead factory.
Yeah.
So I'm going to turn it back over to Mark, and he's going to summarize some key points, and I think we'll have some time for questions by chat if you've got some questions out there.
Go ahead. No, suggest people put those in. I'm looking at the questions and the chat box, but I think the things we've seen out there, not understanding variation, not understanding these principles leads to problems such as pressuring people to get better results by just working harder within the same system. That's not lean thinking, of course. It leads to wasting time looking for explanations of a perceived trend when nothing has changed. Now, this is one of the things I think is a problem in the context of daily lean management. You have people doing daily charts, and then they end up wasting time running around looking for explanations instead of working with people on more systematic Kaizen and continuous improvement. So I think this could be an example of wasted motion for managers. Taking the wrong sorts of actions in response to variation, confusing common cause and special cause, not focusing on systemic improvements. If we just keep asking, hey, why was yesterday a bad day, instead of asking, why is the system not performing a certain way? So quick recap. Don't blame individuals for performance variation that's actually due to the system, and don't ask for special cause explanations when the chart shows common cause variation. Those are some of our other key points. So with that, here's our contact info, Twitter, email, web. There's a question. I'm going to moderate questions. Maybe a question for you, Mike. And I think, I know this was submitted earlier, but it ties into your slide about performance appraisal, I think. Would Dr. Deming ever consider an individual to be a red bead?
Well, I can remember a conversation where there was a woman who claimed that if she wasn't going to be allowed a certain thing, that she was going to act out, and then Deming said, well, then you should be fired. And there were situations where Dr. Deming said it's clear that we have to point to the individual and say perhaps the individual is mismatched to the task. Perhaps it was our fault to put them in this situation. But he never, it was always the system. But he did point out there could be some situations where clearly the lens should be put on the individual. And many times he was pointing out to somebody in management that if they didn't really understand this and if they didn't really want to change the way that they managed, maybe they had to find some other situation because they were a barrier to improvement.
Yeah. And when I hear people blaming individuals or talking about C players or bad performers, and I was kind of ask, well, why are those? If it's really true that they are unacceptably bad individuals, why are they working in the organization then? Like, that's the product of a system. And I mean, I challenge the assumption that there's that many bad people, but I don't see people stepping back and asking, what's our selection process? What's our training process? What's our supervision process? What are our quality processes? You can't just keep firing the bad people and bringing in new ones. You're going to bring in more bad people, probably.
Exactly
question
right.
here. Oh, I'm sorry.
Exactly right, Mark.
What's the correct mathematical calculation for control limits? Is it only 3 standard deviations? Can I use 1 standard deviation to identify unstable processes? So I would recommend taking a look at what's called the Western Electric rules for control charts. The 3 sigma control limits are not the only control limits that matter. You also have 2 sigma and 1 sigma limits on both sides of the mean. There are certain rules that tell you if you have X number of points within certain ranges, that's probably statistically unlikely. Like if you had a point fairly high, a point really low, a point really high, a point really low, close between the 2 and 3 sigma limits, that's probably statistically unlikely. That might suggest that you go look for a special cause, but that's the thing to go look up, the Western Electric rules.
Yeah, Don Wheeler also wrote a great paper called Contra 2 Sigma, and people are always trying to reduce the action limits to less than 3 sigma, and he pointed out that the reason it's 3 is it was an empirical conclusion based upon what works. That's when you make the least amount of mistakes. And he showed that if you try to change it to 2 sigma and use that for action, it's another example of tampering where you're going to make matters worse.
Yeah, and maybe we can squeeze in one more another question. My hospital's CEO recently told me he wants our hospital to be top quartile in everything it does. And I'll interject. I hear people saying we want to be top decile. I wonder what the red bead experiment tells us about whether a statistical target such as this is appropriate or even achievable for a hospital. I don't know if it's a good goal. I mean, I think it's possible to be top quartile because now you're looking within a broader system. There's going to be variation within that maybe more national scale health system.
I can imagine Dr. Deming reacting to this, and I can see that if he was still alive, he would, and when he was doing the red bead factor, he would say, management has just declared that we need to be top quartile performers, and it would be just like another exhortation.
Yeah.
His response would be, by what method? By what method are you going to get there? And just wanting it to be is not the same as actually taking action to improve all the systems that get you there.
Yeah, and I'm less interested in benchmarking than I am working toward perfection. Being in the top quartile of an equally bad bunch wasn't really good for the Detroit automakers, pardon the analogy, and it might not be good for healthcare organizations that are all, I hate to say it, all harming patients. So I think we can aim higher, but it's a matter of what method. How are we going to improve? Maybe I'm going to keep asking questions until someone cuts us off. What did Deming replace performance appraisals with? Well, we see companies doing this today. Even GE they've already eliminated the stacked ranking, rank and yank. They're shifting away from annual performance appraisals to more ongoing coaching and feedback, which I think, Mike, chime in. I think Dr. Deming was upset about the annual cycle, right? The artificial annual cycle. He said substitute leadership.
Institute leadership, and in the research that we did, we're going to be talking about in tomorrow's presentation, we found 2 organizations, and they were both healthcare organizations, that were no longer doing the performance evaluation system. And people were curious about, so what do they do differently? Well, you're exactly right. They have a system of everyday feedback and conversation, not about how individuals are doing, but how people are doing, or how the systems are doing. And then they learn when to take action on the individual. But it's not a ritual sitting down once a year or even quarterly. Changing the frequency doesn't matter that much unless you change what you're talking about. And again, it goes back to, it's not the individual. Let's study and improve the systems. And that's what he was pointing at. So Deming would say you need to think about leadership. You need to think about different questions to ask. And this belief that once a year or once a quarter you can sit down with people and use it for feedback, using it for administering pay, using it for a lot of different things that you're trying to get it to do, is simply not going to work. It's a substitute for management.
And I think there's hopefully more companies that are eliminating the annual performance review and replacing it with ongoing learning and coaching and education. I have a friend of mine, I won't say which firm, a friend who works for a rather large global consulting firm. It was in the news for getting rid of their annual performance reviews. And I asked her, so what's the plan? And what's replacing it? And she said, I don't know. Or, I hadn't been communicated to her as a leader in this organization yet. But we got to replace it with something. Another question here, can you speak to the limitations of benchmarking? We could do another webinar about that, but I think one other point I would make is, it's just, again, thinking back to the auto industry. Like back in the day, if GM had benchmarked itself against Chrysler and Ford, they would have said, we're doing fine. And then, Honda and Toyota enter the equation. And I think people in Detroit were dismissive, like, well, they build little small cheap cars, and it doesn't really matter, and they're not in the same league as us. And then when they started really competing and taking business away from GM, I've been reading, there's a lot of great stories in this book called Comeback, from 1994 about the auto industry and GM and NUMMI. But there's a story in there about a GM employee coming back with benchmarking data to GM executives who said, Toyota changes their stamping dies over in about 3.5 minutes, and for GM it would take 8 hours. So you had benchmarking data, different limitation. The executive said, you're lying when presented with the better benchmarking data. And so I've heard similar things in healthcare. When you hear about places that have eliminated central line infections by 98%, that's not possible. I think, it's this funny dual-edged sword with benchmarking, where benchmarking sometimes sets unnecessary limits to how far we try to improve, and then sometimes people are really dismissive of the benchmarks as not being real, or, but we're different. I think a lot of times it's just a big distraction away from actually improving. Mike, I'm sure we could get you wound up about this topic.
Yeah, I spent a good chunk of my life with people in this belief that you could benchmark productivity numbers for different departments and then go to someone and say, look, these people can do it, you can too. You haven't done a thing to change the system. You also haven't done anything to realize that there's something about their system that may be different than yours. And so this shortcut we take on numbers, and we don't really think through all of the things that have to take place, all of the parts of profound knowledge, and it goes back to a hope for instant pudding, which is what typical benchmarking does, is just pointing out how somebody else is doing leads to action, and it's a shortcut, and it's not going to work.
Yeah. Well, let's tell one quick benchmarking story. When I was at GM as an industrial engineer, and this was in the first year before we got, well, I'll call it the lean plant manager, who had been one of the GM people at NUMMI originally, learning from Toyota. We would have these charts, and it's a very simplified version of productivity of a benchmark engine plant. A Ford plant had better productivity than the General Motors plant. And instead of focusing on improving our productivity, I got asked to basically come up with and articulate and spell out, all of the different reasons and excuses why. Like, well, if you considered that factor and then that factor, and if you looked at that, our productivity is really better. When the number was clearly worse, but it was this sort of exercise in explaining away why the benchmark wasn't valid, when it was very much the same large, high-tech V8 engine. I had to do that because my boss told me to, but it was just it seemed like an exercise in futility.
It was.
Will the webinar be available for viewing or downloading afterwards? That's the intent, right?
Yes. Well, we'll have a recording, and people can access that recording. We'll send it to the people that registered, and also make it available through the Theta Care Center at the Healthcare Value Network.
Okay. Well, should we go ahead and wrap up?
Yeah, I think so. This has been helpful. Well, we appreciate everyone's time today. Mark, thanks for the great leadership in putting this together. It's been fun, and we'll be following up with the folks that want to learn more through the email process. So, and Nicole, thanks to you also for helping us to get this organized today.
Yeah, thanks, Nicole. Thanks, Mike. Thanks for everyone for being here.
Hope everyone has a good day. Bye.